Having surgery of any type, simply by nature, is frightening. And the preoperative visit is an opportunity for you to change your level of understanding of the entire process. And my goal is to give you the basic contour of this interaction as I see it and what I see as most important as far as the takeaway. Now, understand that from a practical standpoint and from a legal standpoint, this entire interaction is referred to as informed consent. Now, I think this should actually be called educated consent, because you can inform patients about a lot of things without them actually grasping and understanding what you're talking about. So I think it is helpful to give you a very specific framework of 5 critical questions that you can make sure have been fully answered during this preoperative visit. Now, it is the surgeon's responsibility to bring that information to you in a way that you can understand and to educate you, and it is your responsibility to ask questions when you don't understand so that the surgeon can expand on their answer. So let's go through the questions. Number 1, diagnosis. Doc, what do I have? What is it called? What does that mean? Understand what is wrong with you, and don't move beyond that point until you do. Once you have a grasp on what is actually wrong with you, then the treatment. Number 2, what are you going to do to me? Step by step, from start to finish, and all of the pieces that go along with this. How long is the operation going to take? How long am I going to be in the hospital? What is the recovery? All of those things need to be addressed in the treatment section. Number 3, risks. Doc, what can go wrong in this operation? What are the potential bumps in the road that are well known to happen with this particular procedure? And if it is an operation of fairly significant magnitude and there's a chance that you potentially won't survive the operation, what are those numbers? What does that risk look like? The benefits. What can I expect after this operation? Am I going to feel better? Am I going to feel different? Is this an operation that you're doing to prevent a disease process from getting worse? What expectations can I have as a result of the benefits? Alternatives. What are the alternatives to having this operation? Are there less invasive procedures that I can undergo? Is there any medical therapy that I can undergo? Are there any alternative treatments that are available? And is there an opportunity for me to potentially go to a higher level of care for 2 reasons? 1, because there is expertise that is at a higher level than what I can get here in town, or do they have technology potentially that make this whole process either easier or better? And I think that if you answer these questions fully, you will step away with a very different perspective. It won't make the operation any less scary, but I think there's a great deal of comfort when you understand the risks and benefits of an operation, and that you know that you're making the best educated decision for yourself. I hope you guys have a great day.